We're going to start with the tissue on the IT band. So that's knee to hip. And then we're going to go underneath hamstring, and then groin, and then glute. Okay, so to hit your IT band, you want to go the complete length of the muscle, but I always tell everybody to start in the middle, work your way down, and then back up. So to set up for a good IT band roll, you're going to get completely on your side so your hips are over. Okay, so right now I'm nice and straight, I have good alignment, and I'm going to pull myself back and forth with my hands. So I'm going to pull back and forth all the way to the top of my hip and all the way down. You might have to pull yourself a couple times or adjust this down so you get right on top of that knee, right outside the knee. Okay, so you want to get a good long pull, and if you get stuck on a point that's irritated, you can just put your foot on top to lessen the pressure. So when you get stuck on a spot, and I'm ready if you can, just watch my foot, what you're going to do is just curl your foot back to break up that knot in your leg. Okay, so you want long rolls, back and forth. Same thing if you get stuck on a sore spot, I'm just going to move that heel close to my glute. Just a couple times. Just going to move it back. Right now you're just trying to highlight any tight areas. Okay, next all I'm going to do is get nice and straight. I'm going to sit up, use my hands to support me. I'm going to prop myself up, and I'm going to go underneath. This is the hamstring. So same thing, we want long rolls. We just don't want to go short and aggressive. We want long, smooth rolls. And if I want to hit different parts of my hamstring, you're just going to take your foot, toe it out, or toe it in. So if I want to actually go closer to my IT band where I just was, I can toe my foot really far out, or I can toe in and get closer to the groin. All these areas, typically with a back problem, are sore and or tight. Okay, so that takes care of the outside of my legs. So next are the groin and the glute, usually tight areas. So I'm going to get on my back, or my belly, okay? I'm going to keep this next to me. I'm going to pop my leg up, and I'm going to start rolling on the inside of the knee, which is usually tender for a lot of people, and then I'm going to move up as close as I can tolerate towards my hips. So I'm going to actually push down, same thing, I'm going to flex and extend my knee a couple times just to really trigger point that. You can even take your hand and push it down, okay, to start working through some of those tight areas. I'm going to move closer to my hips. That's going to help break up any tissue in my groin. If the groin's tight, your hips are tight, and then you don't have hip mobility. You can't move through your hips. And that's what you want to do with a back problem. You want to be able to stabilize your back and move through the hips. Okay, last but not least, we have the glute. Okay, so to set up for a good glute roll, same thing, I want to prop myself up. Now you can do this a couple ways, whatever works for you. You want to tilt whatever glute you're rolling, you want to tilt the knee out. So I'm going to tilt out and roll. The other way you can do this, and you want to roll all the way up to the top of your hip and all the way to the bottom of your glute. You can feel the hip bones at the bottom, and when you go up top, you can feel the top of the iliac crest, the top of the hip bone and the bottom. You can also go here if you're feeling good, and you can work the hip that way. Okay, this is also a very good glute stretch. If I take this foam roller out from underneath me, this is also mimics a glute stretch. So if I wanted to stretch my glutes, this is a position that I'd want to be in to be able to stretch them. So I just mimic that same position. All I gotta do is go right up here, and it's the same thing. I'm just working that tissue out. Okay, so that works on the global tissue attack. Next, what we want to do is start rolling the upper part of your, what we call just the thoracic compartment, a lateral compartment right here. So to do that correctly, we can do that a couple ways. You can just go here and roll, and it's very uncomfortable. It's right behind your armpit, so not on your armpit. This is on my armpit. this is behind it. The armpit should be up and tilted. The hand is up, okay? And what I'm trying to do is go all the way down my rib cage and up. Same thing if I get stuck on a spot that's icky, okay? Move the arm. Move it up, down, around. Just search for range of motion, and then I'm going to go back and forth with that. Okay, another way I can do that is I can crisscross my back. I can wind up my tissue, hike my hips up, and I can get in there that way. Okay, and I can use a little mobility to hit the back of the scapula, my T-spine, going side to side, getting all that stuff loose. That'll prepare me for the stretches that I'm going to do. So all that's loose. If you had some really knotty areas, you can hit them with the ball. So the ball stuff you can do is similar to the other rolls. Usually the most tender part on someone with back pain is going to be the glutes and underneath the back, right around the erector spine that runs side by side on the spinal column. So same thing, revisiting this glute stretch, I'm going to stick the ball under there and I'm going to roll in circles and or side to side. So I'm going to roll, usually when I do this my hips adjust actually, and I'm going to find a really terrible spot and I'm going to just sink into it. Okay, if that's too painful, drop the knee down and just open and close. There's a lot you can do here. So once you find a really knotty area, I want to be able to break it up via movement. So I'm going to either move side to side or I'm going to stick on that spot and move here, or I'm going to move up here. Okay, either way it's going to cause some opening up in my hips. So same thing, I'm going to roll side to side, really work that out. Okay, there's always icky areas. So that will take care of your glutes. Alright, next you want to get into, I'll show you this way. This is the lumbar, okay, region where most of the trauma is, correct, right? Am I right there?
Yeah.
Alright, so this is your multifidus, which is very close to the back. And your erector spine are these big guys down here. There's a million little muscles in your low back, but today we're just going to focus on getting this ball in the optimal spot. So usually if you palpate, so if you take your thumbs, find the tops of your hips. Okay, right above there. That's what we're, and for you it might be higher. Can you see where my fingers are?
Mm-hmm.
Okay, so what we're trying to do is just find an area that doesn't feel good. Okay, so this is the best way you can do this, and if you're seated at your office or whatever, this is a good way to do it. I always prefer to do this. I just don't want to get my shoes under your thing here. Find the spot and elevate your feet. So I'm here. I'm going to pop my feet. I want to get as close as I can. And if your back's really tweaky that day, you might have to literally just place your legs up. I know my back tweaks. I have to literally take my legs and place. Okay, so notice my hip. Right now I have a huge curve. All right, in my thoracic spine. What I want to do is get that down. So I'm just literally going to take my ribs and push them down. Now how I did that, I didn't just jam my ribs down. My hips rolled underneath. So I'm going to roll them so the small of my back completely touches the floor. Okay, so that should pull your hips in the correct alignment. My pelvic floor is underneath my body. Just that should set your hips in a better position. So right now I'm about 90 degrees. I'm just going to hang out here. So what I want to be able to do is to get out of this position, which just pulls on your lumbar, and I want to tilt. Okay, so now I'm flat. So you can notice A, doesn't look so good. My shoulders are elevated. B, my hips are underneath. My shoulders are down. I'm just relaxing here. I'm going to take the ball, okay? And typically you'd want to have two of these to even it out so you're not kind of crunching on one side. And I'm going to find that spot again, roll it on there, and I'm just going to hang out here. Okay, yeah, it doesn't feel good. You're going to find a spot that doesn't feel so hot. What we're trying to do is relax in this position, so I don't want to be here again. Hips rolled under, that's going to put pressure on the ball the correct way. So in this position, what we're going to practice doing is breathing correctly. So I'm going to breathe into my belly and not my chest. So a really good way to do this, hand on the belly, hand on the chest. Okay, so I'm going to just practice doing is elevating my bottom hand. It's doing two things. It's forcing air and blood into that area. And two, you're just practicing breathing correctly. I can't breathe here. I mean, I can, but it's not good to be in this position. I'm going to roll my hips. Okay, that's loosening up the back. And I'm just going to find that spot and practice breathing there. I would start there. Okay, and then I want you to zoom, just click on that. We're going to start the second segment. So that's all the